Welcome to the 707, a weekly half-hour program produced by KRCB, a service of NorCal Public Media. The 707 features voices and stories from your community, stories that explore how we care for those in need, and stories that show how we are connected to each other. I'm your host, Michelle Marques. Today, I'll take you on a tour of the new home for a nonprofit organization called Ceres Community Project.
This is what we're calling the Center for Food, Youth, and Community. So it's in our new regional headquarters that will serve the 5-county area of the North Bay.
I'm at a busy work site in West Santa Rosa with people in hard hats running graders and compactors. Cathryn Couch is the CEO and founder of Ceres Community Project, and we stand to the side as the work continues around us.
We are a medically tailored meal provider. We serve all of Sonoma and Marin, and then Medi-Cal members now in Napa and Solano counties. So we provide 100% organic meals that are medically tailored to serve people's nutrition conditions. About 82% of our clients are living on less than $30,000 a year. They all have serious medical conditions, and about half of them are living alone without support. And between 2019, pre-COVID, it feels like a long time ago, and now we are serving 3 times more meals than we were. So we went from 80,000 meals a year. This year we're going to deliver at least 225,000 meals. And a couple of years ago, about 3 years ago, we realized that the way we had been organizing with 3 kind of small locations, 2 of them leased, was probably not going to serve us for the long term. And so we started a conversation with our board in 2021, did a feasibility study, and launched the capital campaign about 2 years ago. And the project started a year ago in September. And we will be complete in December and moved in January.
Wow,
yeah.
That's great.
So tell me a little bit more about Ceres, this model that you have.
We started 18 years ago. The basic idea was bring teens in the kitchen and teach them how to cook healthy food and have those meals go to community members in need. And at the time, I was researching a book on the food system, and we are raising a generation of young people now who, for the most part, are not growing up in families where cooking's happening. And I found that terrifying as someone. I'd say I learned to cook by osmosis, right? Because cooking was happening in my household. We're raising a generation that's really at the effect of a food system that does not have our best interests at heart and don't have that basic life skill and don't understand the way that food can improve their health and protect their own health, but also thinking of food and how we source food as a way that we express our values in the world. And we know that when people are sick and most need to eat well, it goes to the bottom of the list for so many, many different reasons. And so when the idea came to me in 2006, I ran a home delivered meal business for 10 years. So I was like, I could do that. And so Ceres started basically as my one-day-a-week volunteer project in 2007 with me and 6 kids cooking for 4 families out of the Sebastopol Community Church. And so that was the core idea and is still, that's still really the core of what we do. And I think there's 2 things that happened in the first couple of years. First, every single client that we cooked for basically said, I can feel the love in the food. And to know that all of these people who I don't even know are making this happen, it feels like the whole community cares about me. And at the time, in 2006, a study came out where they asked Americans, if you had a crisis, how many people could you turn to? And in 2006, 25% of Americans said no one. And really, if you go back 100 years, it is unlikely that anyone would have said no one. So there's something fundamental that's changed in the way that we are organized as a human community. There's a whole other body of research that basically looks at when we feel lonely and disconnected, our health is far worse than if we feel cared for and connected. So one of the things that we've layered in is this idea of strengthening social connections across the community, which is why we have 1,000 volunteers a year involved, and understanding that food is both nourishment, but it's also a way that we communicate care to one another. And on the youth side, it was like, we're going to teach kids how to cook. And we started to watch all of the ways that we were helping young people build their confidence, gain job skills, understand their ability to make a difference for someone else, find purpose. And so now we have a fully developed youth development program, and we help young people find their value and belonging as contributing members of the community, and they all learn how to cook and eat kale. But it's in that order, right? We're not a culinary job training program. Some of our kids go on to culinary, but many do many other things, nutrition and medicine and all kinds of things. But we know that if young people find their value and connect to their agency, then anything is possible, right? And they will become the leaders that we need for the future.
Now, there's also an element of growing food. Can you tell me about that?
Yes, so we started in 2012. So we call ourselves a soil to community food system organization. We started with organic because I was like, I'm not going to cook for people in a way that I wouldn't eat for my family. But there's two different sides of the equation. One is most of our clients are not eating very much. So we are committed to packing as much nutrition into every bite. And the research now around organics is if you're eating an organic diet, it's the equivalent to eating at least 2 extra servings of fruits and vegetables a day. So for a client, there's a value. But we are a health and well-being organization, and so we also don't want to source food in a way that is causing illness and health disparities in the food chain, right? So there's a system level impact and there's a personal level impact for us. People are not healthy in isolation. They're healthy in a healthy community, in a healthy food system, in a healthy environment. So our commitment to organic, by operating our own gardens, we're modeling that piece of what we believe in. We started in 2012 with a 3/4 acre garden at O'Reilly Media in Sebastopol. We moved that garden about 3 or 4 years ago to the Sebastopol Charter School. It's now about 1.5 acres. And then we added a garden last year in Petaluma that's about 1.5 acres. And so those organic gardens are youth-run sites. So we have youth in those 2 gardens and in our kitchen in Sebastopol and our kitchen in Novato. And they are coming after school. They are learning to grow, cook, and eat healthy food. Last year we grew 12,000 pounds of food. This year we think it's going to be 25,000 pounds of food. That's a drop in the bucket of what we actually use in the program, but it's a significant amount. And again, what we're modeling is where food comes from and how we grow it matters, and giving kids an opportunity to learn that on the ground. We care about policy because policy affects our ability to do our work, right? So we are very, very active in the policy space, really around 2 things. There's a very big body of research now supporting medically tailored meals. What the research shows is we can improve people's quality of life and their health outcomes and reduce healthcare costs by leveraging medically tailored meals. And so we are very much involved both at the state level and the federal level around integrating food as medicine interventions into healthcare as a covered medical benefit. I started a conversation with Senator McGuire in 2016, which led California to fund the first in the nation statewide pilot of medically tailored meals in Medi-Cal. And now California is one of 16 states who are basically piloting food as medicine within their Medi-Cal programs. So we have a contract with that. So we work at the state level and the federal level around that. And then the second thing is, what kind of food are we going to scale in food as medicine? And so that whole piece around organic, regenerative, local, really big advocates for the value of locally based organizations doing this work. Because healthcare dollars are now available for food, there is a tremendous amount of venture funding going into national companies that are not based in our community, that use really poor quality food. So we are really, one of my favorite stats is 78% of our adult volunteers improve their eating habits after getting involved with us. That doesn't happen when you're making a meal at a factory in Iowa and shipping it to somebody's door, right? There's a different level of trickle-out effect that happens when you've got an organization like us doing this work in the community and engaging community in the work itself. We, as an organization, are really proud to be at a position now where we're at a lot of really important tables, both nationally and at the state level, being able to shape the conversation around food as medicine. 5 years ago, not a lot was moving, and then President Biden held the White House Conference on Food, Nutrition, and Health in 2022, first time in 50 years, and it just has accelerated the conversation around food as medicine and medically tailored meals. I was sitting in on a federal Senate Ag Committee hearing a couple of years ago about the Farm Bill, and Senator Cory Booker was like, we should be funding medically tailored meals. And part of me was like, what has happened, right? Because now there is this kind of general understanding that food matters and that we can make a difference by investing in the right kind of food for the right people. And that's really exciting. So we're proud to be one of the organizations that's shaping the conversation and basically the leader for food as medicine north of San Francisco.
And that's such an amazing thing that even people working here, people who are not receiving these meals, but they're starting to understand that education as well and making changes in their own lives.
Yes, exactly. And we do some alumni surveys for our youth, 2+ years out, still cooking 4 times a week or more from scratch, still eating a primarily healthy diet. The reality is, right now, poor diets are the number 1 cause of mortality in the United States. 600,000 to 1 million deaths a year in this country have poor diets as a precipitating cause. 85% of healthcare spending is chronic diseases that we could prevent by lifestyle change. I mean, it's really crazy when you step back and think about that. And again, if you go back before World War II, we were all eating a 100% Whole Foods organic diet because that's all that there was out there, right? So what did we lose? We lost some knowledge, right, in this industrial food system and subsidizing poor quality food and all that. And so part of it is, how do we reclaim that knowledge? How do we think of food as first medicine, right? How we eat, literally basically moving to a whole foods diet improves everything. And that's the message. We deliver 225,000 meals a year to 1,600 clients. But the idea is that we're shaping that conversation about food and health for the whole community, and that many other people are making positive changes that will lead to them improving their health as well.
In the next segment of the 707, Cathryn Couch, CEO and founder of Ceres Community Project, takes us into the new facility in Southwest Santa Rosa. This is KRCB.
KRCB is Sonoma County's NPR station, celebrating Sonoma County by featuring the voices, sounds, and culture that make our home unique. From the heartwarming tales of postcards, where residents share their perspectives.
It's been a wonderful day here at the Grappling Apple Fair.
To the Arts Brief series, shining a spotlight on the incredible youth in the arts scene.
My full name is June Zelda Grable, and I'm working with a theater for children on a production of Beauty and the Beast.
And Farm Tales, with the latest from local farmers, celebrating happenings on their farms and trends in California agriculture.
Our farm is called Monte Bellaria, which means Mountain of Good Air in Italian. We now have more than 9 acres planted of lavender, about 35,000 plants.
KRCB is a journey into Sonoma County. This is more than radio. This is the voice of your community. Your stories, your station. KRCB 104.9, Sonoma County's NPR station.
Welcome back to the 707 on KRCB. I'm your host, Michelle Marques, and I'm standing outside the new facility for Ceres Community Project, where construction is underway. CEO and founder Cathryn Couch says this new building will help them expand services.
We really wanted to make sure that we were building a solution for the long term, not that we would grow out of in 5 years or 10 years. So this facility, right now, 225,000 meals a year. This facility will allow us to go up to at least 800,000 meals a year, which we plan to do over the next decade or decade and a half. It also has a number of spaces for, again, community nutrition education. So there's a lot of other kind of programming that we're going to be able to bring in once we're in here.
Where does your funding come from?
We have a very diverse funding base, which is really important for sustainability. So about a third of our funding is from individual donors. About a third of our funding is from corporate partners, foundation, and a small amount of government grants. And about a third of our funding now is healthcare contracts. So this facility, this was a $22 million project. It is fully funded. We've been involved in fire response since 2017. So we hold the contract with the County of Sonoma and the City of Santa Rosa for meals at shelters. And this facility will also serve as a community resilience center for Southwest Santa Rosa. It is 100% electric. And again, this is a value thing for us, but we're going to reduce our carbon impact by 81% per meal and our utility use by 65% per meal. These are all the pillars for the solar in the parking lot, but solar, and we have a full battery microgrid, so we will be able to operate for 10 days without power. And so thinking about the big picture of this facility as a community resource. I toured about 10 days ago. The Sonoma County Emergency Management Team came over and toured the facility. We sit on the Shelter Council for the county, and having them understand what this is going to make possible We have freezer space here that can store 10,000 meals. So for example, if there's a major earthquake, we could serve our clients for 2 to 3 weeks with frozen meals and have the entire capacity of the kitchen be serving emergency needs. So those are some of the things that we thought about when we designed it.
Amazing.
Yeah.
All right, let's tour.
Okay, so this is the volunteer entrance over here. So there's a kind of a oval driveway. So our delivery angels, we have 200 or 300 people a week that help us deliver meals. So they will come in and the racks with meal bags will come out under that overhang over there. So that's the volunteer entrance. Main entrance is over here. And the 2-story gray building is our community meeting room. It's 2 stories. And that opens up on what we're calling the community plaza area. So there'll be a big outdoor space. We can have 200 people back there, and there'll be outdoor meeting areas and all of that. So I think this is open. So we'll go in we can go in the main entrance.
Couch says there are plans to use nearby open land for an on-site garden, but they've not yet been finalized.
Okay, let's go in the kitchen, because that's where the exciting spot is. And I also will say we really wanted the kitchen to have natural light, and kitchens are always in the middle of buildings. So our architect made basically the kitchen 2 stories with 9 skylights. And then upstairs is all our administrative offices, and they all ring the kitchen. So the kitchen's essentially the center of the building, the heart of the building. This is the hotline. Our Sebastopol building right now, where we're now making 160,000 meals a year because we lost our kitchen in Santa Rosa last year. That building is 3,000 square feet. This first floor is 15,000 or 16,000 square feet. So we're going from something like 400 square feet of walk-in space to 3,000 square feet of walk-in space. This whole area that we're standing in is the prep area. This is as big as our Sebastopol kitchen right now. The other really driver of this was to be able to be as efficient as possible with the resources the community entrusts us with. We have a whole different scale of equipment here, more volunteers able to be on site at any given time, and that's going to allow us, we think, to reduce our per meal costs by 10 to 15% in the first year and then continue to reduce as we scale. So we can do more with less, which is also really important as a nonprofit. Yeah, so this is the hotline. Back wall will be refrigeration. There's 5 different walk-in refrigerators. Each has its own purpose. This one off the kitchen is just for things that are in process. We can go back and see receiving, and then we'll walk over to the packing room as well.
You explained a little bit about where your funding comes from and that it's diverse, which is probably good because you can't count on the same kind of money year to year, right?
Yeah.
So how have things been impacted by the state budget and the federal budget?
Yeah. So not too much yet. So we have very little direct federal funding. We do have currently a grant through U.S. Department of Agriculture that is funding a 4-year perinatal pilot, so low-income pregnant moms, with a combination of meals and produce bags, where we've actually been able to show significantly improved birth outcomes. We had spent about half of that, and half of it was sitting in a treasury account. And in February, when the funding freezes started to happen, we actually eventually pulled all of it into our bank account. So none of it's at risk. The second thing that we were really concerned about was tariffs and the tariffs' impact on solar panels and batteries for this project. But we've been able to confirm that everything is in the US, and we changed the batteries that we were using so that we didn't have to deal with tariffs. And the third thing also related to the building is $1.2 million of the budget for the building is coming from what are called direct pay incentives for solar and batteries under the Inflation Reduction Act. What came out of H.R. 1, the bill that just passed, is they're phasing those out, but if you start construction within 6 months, they're still available. So we have confirmed they're still available. We are seeing some loss of funding through foundation partners who are getting their funding cut. So there are some trickle-down effects that we're seeing, but the biggest impact really has to do with Medicaid, because we are a healthcare contract under Medi-Cal in California. There's 2 kind of things that happen. One is the state budget's being cut, but for the Medicaid plan that we contract with, as work requirements roll out and the issue of people having redetermination every 6 months instead of year, there is an expectation that people will lose their coverage, right? And as people lose their coverage, the plan has less revenue to work with. And so things like medically tailored meals that are an optional service that the plan can offer become at risk. And so None of that is now going to roll out until late 2026, early 2027. We have big concerns about that. I was on a webinar today. The state is very committed to what is called CalAIM. So this is essentially a 5-year project that the state is doing to transform Medi-Cal, and that includes medically tailored meals as one of the new kind of optional services that are designed to help us improve people's health and manage healthcare costs. And the state seems very committed still. So we are doing a lot of policy work around making sure that that continues and shaping how that service is offered statewide in a way that we are ensured that we can demonstrate cost effectiveness. So again, if something is improving someone's health and quality of life and they feel really good about getting that, and it's also at least cost neutral or cost savings, then why wouldn't you continue doing it? But this is going to be the next 18 months of really continuing to advocate for this. And I think the other big thing, of course, is, what's happening with immigration. And, we've had delivery people say that clients were afraid to open their doors. There's a confusion that getting meals from us is public charge, which limits people's ability to get their green cards. So there's a lot of misinformation, a lot of fear out there, which is also affecting our ability to do our work and to serve people. Yeah. And I haven't even talked about food stamps, because that does go into effect right away. So we know that as food stamp benefits are cut, that there's going to be even more need for our services. Yeah.
Couch says the new facility will be completed by the end of 2025 and they'll move in January. Learn more at ceresproject.org. I'm your host and producer of this program, Michelle Marques. Thanks for listening. This show is a service of NorCal Public Media. Our president and CEO is Darren Lachelle.